Types of chemotherapy. You are prescribed a chemotherapy treatment which matches precisely your situation. This depends on your type of breast cancer, how serious it is for you, your age, your condition, and your weight. There are several types of chemotherapy medications which can be prescribed in several combinations. Each type of medication has its own side effects. Ask your doctor or nurse to explain why you are prescribed one particular type and why they expect that it will work towards your recovery. Let the doctor or nurse know clearly what type of medicine you already use, for example, against diabetes or arthritis. They need to take this into consideration. The treatments will be administered in the oncology department of the hospital or polyclinic. After each chemo session, you may go home. Most of the time, you are given the treatment intravenously in your arm. Each session lasts about 1 hour and a half to 2 hours and a half. There are mostly 2 or 3 types of medicine within a 1-hour session. A couple of plastic sacks hang on a kind of stand, the intravenous stand. They contain the chemo fluid, and this is your treatment. At the hospital, there are special rooms for chemotherapy with comfortable chairs and sofas. During the treatment, you can listen to music on your headphones, or read a book, or watch TV. If a friend or a partner is with you, you can spend time together. When it is over, it can be that you do not feel very well. Therefore, it is a good idea if somebody takes you home. You can also take a taxi home. Just make sure in advance whether the cost of the taxi is refunded by your healthcare insurance. The preparation. Before the start of the treatment, you have a consultation with a special nurse. This is an important conversation, so ask in advance if she can arrange for an interpreter. This nurse makes the arrangements for you. The nurse will also give you an appointment schedule for the chemo treatments and the blood tests. The blood tests take place the day before the next treatment. The blood test shows if the healthy cells have recovered enough to sustain another chemo session. Therefore, you need to go to the hospital each time. You will be asked a lot of questions, for example, about your condition and how you eat and drink at the moment. You too will also have a lot of questions. For example, how will the treatment go? Which side effects can I expect? How do I cope with the side effects? When do I need to get in touch with the hospital?